President Cyril Ramaphosa signs the NHI Bill. They say the objective of the NHI Bill is to provide universal access to quality healthcare for all South Africans.
947 Drive with Tando.
This is 947.
Apparently, the medical community is rejecting the NHI Bill. Doctors threatening to leave South Africa.
Well, everyone is also surprised that the president has finally found his pen, because this has been years in the making. And
He sent his assistants with the jet.
Yes, there we go. 13 days before the elections, now all of a sudden he's found his pen. And of course, the cause of access, equal access, right, to
Yes.
healthcare for all South Africans is a noble cause.
Yes.
But the
Yes.
big fight is the NHI Bill is problematic in its current form. And a lot of people are worried about how it's going to be funded, because most of it will fall on the taxpayer.
Yes. It says here the cost of our healthcare system, which is currently the most expensive in the world, will be reduced. This is the bill that I'm reading, like parts of it. It says when people visit healthcare facilities, there will be no fees charged because the NHI fund will cover the costs of people's medical care in the same way that medical aids do for their members.
How I also understand it is that all services that are provided by the NHI will then no longer fall under medical aid. That your medical aid will only provide services that aren't provided by the NHI. So you, in essence, you don't really need medical aid, because we're all on an equal playing field and we can all access all hospitals in the country.
So now, obviously, all the medical insurers
Up in arms.
are up in arms saying, well, then we are now null and
100%.
void.
What then happens with public healthcare? Does that then get absorbed into the private sector?
Correct. So that then needs to be fixed and be up to the same
I was about to
standard
ask that.
as the private hospitals.
Because, I mean, it's fantastic that we're all at the same playing field, but I should then be able to choose to go to any, because now there's no private hospitals
No,
anymore.
there isn't.
Yeah.
Now everything is a public hospital, and I should be able to choose to go to Para or to go to Four Ways Life, and I should receive the same level of healthcare. President Cyril Ramaphosa signs the NHI Bill. They say the objective of the NHI Bill is to provide universal access to quality healthcare for all South Africans, as enriched in the Constitution. The Constitution recognizes healthcare as a fundamental human right and states that everyone has the right to have access to healthcare services. I don't think that is the issue that's in contention. I think a lot of people are asking, how will we as a country afford it?
Yes.
But also, will the funds, if they are available to fund the NHI, be used in a responsible manner, which is also another great concern of South Africans.
This bill has also been sitting at the president's desk for a while, and you mentioned earlier that, I don't know, it does raise a few eyebrows that it's suddenly being signed a couple of days before we go to the polls.
Exactly. A lot of political parties are describing it as a PR stunt, as a gimmick, because they're saying that the ANC is scared of losing the election.
Well, hopefully we're giving some clarity to this, because I have no idea what the NHI bill is. A lot of people were asking. I saw last night on Twitter, and I think you get empowered by having conversations such as these.
Look, the one thing I will say is there are a lot of countries that have something similar.
Yes.
It's not to say that this is some far-fetched idea that can't be done, but I think it just needs to be a bit clearer as to how it's going to be done, because even people who are analyzing the bill are saying it's not clear enough as to the plan as to how it's going to be achieved.
Well, they're saying basically healthcare is going to be reduced, or the cost of healthcare is going to be reduced or standardized, right? So
Yes.
it means, for example, Lerato, if I go to a gynae, what you pay and what I pay is going to be the same. And we're not going to pay anything because the NHI will.
In essence, you are paying for it because the cost will be on the taxpayer, right? But
Yeah.
let's say if you're unemployed, then you're not paying for it.
No, but I mean, now when I'm at the gynecologist, when I'm done, I'm going home.
Yes.
Well, I don't know. I think it's a catch-22, right? Because on one end, everybody gets access to healthcare. But the question, and as this doctor mentioned, is a question of capacity.
Yeah.
But we already have the problem of capacity. So my thing is signing the NHI bill doesn't change that.
I know doctors are really taking strain. I've got a good friend that after 6 years of studying was actually looking at, I don't know if the term would be hanging up a stethoscope. She is currently working in one of the public hospitals, and she said the difficulty of leaving every day when there's a queue of people who, with basic treatment, can receive help, but the queue is that long that you cannot get through it on your shift. So you've got to walk away at the end of your shift
But guys, that
leaving
already
those
exists,
people
is
behind.
what I'm saying, right? So what this does is level out the playing field. Everybody gets access to healthcare. And I think that's one upside to look at it. But the question is of capacity. But that's something that was already there before the NHI Bill was even signed.
Well, a good thing is that this is not happening overnight. Tomorrow, things are not changing, right? It's still years and years to come before it is formally implemented. But also, there are a lot of legal cases, and this will still go to the courts.
But
so maybe it will change in its form.
Some people may say we wish it was happening overnight so
Yeah.
that we do have access to this healthcare facilities. We've got a doctor on the line, Anonymous. She is a therapist in a private healthcare. Good afternoon, Anonymous.
Hi guys, how you doing?
Fantastic. And you?
Yeah, good, thanks. So yeah, I just wanted to give a bit of feedback from someone in private healthcare. So I think the scary thing that's going on with this is, as mentioned before, this has been a bill that's been in debate for years now. And suddenly, 2-3 weeks before elections, we're suddenly starting to pass and we're starting to sign. And a lot of information hasn't been passed through healthcare either. And so, as much as the public's in the dark, there are also a lot of healthcare workers who are also in the dark. And unfortunately, what's often happening now is we know that there's a lot more money in private healthcare. And so when private practitioners are facing the idea that our job title is going to change, our financial standing might change, the understanding then is it not an easier option to possibly look at immigrating as an option rather than face a changing dynamic in a system that hasn't been tried and tested and that hasn't been explained to us properly. And so we're going to see a massive efflux of healthcare workers going overseas purely because they're scared to know what will happen to their jobs if they stay.
Is this now an idea that you're toying around with?
Yeah, it is, unfortunately, and it's something that if I look at my class, almost more than half have immigrated.
Sure.
Purely because jobs in South Africa are hard to come by. Our financial standpoint in healthcare is already incredibly strained from COVID, and now on top of it, we've got a bill that may change things even further in a health system that's already under strain. And there is money in private, but there isn't enough to equalize it between public and private that brings us to a standing point that still gives workers and healthcare workers a standing point that is worth coming to work.
One of the things that you mentioned there is that there's a lot of questions even from your side how this is going to work. Has there been any communication within the industry as to this is coming up, this could be a thing? Has it been explained at all to you?
So we had some introductions in universities, and we had some open forums, but not to the extent that makes us prepared for if it has to get implemented anytime soon. So not to the point where, as a general healthcare worker, I can give you as much information as you guys deserve to know, and that makes me feel confident. The main reason why I actually wanted to stay anonymous is because I don't want people asking me for details that I myself can't provide. And yet this is a bill that's going to directly...
That's wild. That's crazy. It's like working in an organization and they suddenly change the policy, but you're none the wiser. Anonymous, thank you so much for giving us that call.
947 Drive with Tando.
This is 947.